Hi there, William Quang here from the Adelaide Hill Pain Clinic, and today we're going to talk about dry needling. And we've got Bridget here demonstrating, and Tiana being our volunteer. So dry needling is now used these days quite a bit for a lot of the musculoskeletal injuries. It has been sort of discovered to be, I guess, the gold standard for releasing and lengthening a muscle. So massage and stretching are actually number 2 and 3 respectively. So you might notice that a lot of physios, a lot of chiropractors, acupuncturists and some GPs have actually taken it up to lengthen and stretch people's muscles. So what we'll do today is we'll get Tiana to pop up on the bed there, on her tummy.
Okay, so I'll talk you through what I'm going to do. So first thing I'm going to do is have a bit of a feel on Tiana for any of those really tight parts in the muscle, as well as some trigger points that are found to give direct referral pain to the heel. So one of those is right in between here. And this particular muscle here is often recruited a fair bit of the time to do a lot of the work of the foot. So we've marked Tiana up with 3 different spots. The aim of the game is to relax as much as you can. And all we're going to do is line our needle up on the angle that we want it, release the stopper and tap it in. And we're just going to push it down. We've had a little bit of a muscle twitch there, which is a good reaction for me. It means that I know that the muscles are reacting and releasing. Does it hurt, Tiana?
Yes.
Just a bit of a prick and a twitch.
And then I'll take this one from this angle for you.
Bridget's friends with Tiana, so
I'm not being as nice as I would usually be on my patients. There you go. So we've got 3 dry needles in the leg. These are the 40mm ones with the 22 gauge needles, so they're very hair fine. They're not all the way down, so there's about 3 centimeters of needle into the muscle there, and it's going on the angle as well on a lot of those. So it gets nice and deep, and we leave them in there for about 5 to 7 minutes, just depending on how the muscles react. We can test that by just giving the needle just a little bit of a pull.
Hi again. I don't know what happened there. We don't know what happened, but the internet just went down here.
Yeah.
We've had a few issues with internet in North Adelaide, but it's been about 5 minutes.
Yes.
And Tiana's.
We're ready to pull the needles out. So all we're going to do, straight out, and they slide right out really nice and smoothly. They don't pull any muscle, which means that they're ready to go.
And if you, Bridget, before you throw them out, do you want to just show the people what? So they're literally flexible like hair-like fibres. So they're not like needles that you think that you get from your doctor.
No.
So they really don't hurt that much.
So after we needle, we then are going to hit Tiana with a little bit of cold spray. Literally cold spray. All you're going to do is down the muscles. That's going to contract the muscles and make them shorten, and then I'm going to put Tiana's foot under a stretch. So just against my leg. And we're going to do that 3 times round. How's that feel? You said it feels good. After we've done that once more, we're then just going to warm up the area a little bit, just with a little bit of friction. In terms of post-needling, Tiana, you could feel a little bit tender, but it should pass in about a day's time. Keeping the calves really warm for me today. If you bruise, I've done my job.
Okay, so that's it. Thanks, Tiana. You can wave.
See you guys.
So basically, that's what we do. So dry needling is quite a handy little adjunct to all the things that we do. It's usually in our second line of treatment. We do other things like, the shockwave, strapping. We give a lot of exercises, inserts, giving them right shoes. Anything else?
laser mobilisation.
Mobilisation. So we've got quite a few little tools there. So if you have any comments below, feel free to ask. If you have any friends who may benefit from dry needling, maybe they've tried orthotics in the past, they've gone to other physios, other podiatrists, and dry needling isn't one thing that they haven't tried. It's quite handy and it works a good number of times. Okay, so next week I'm actually catching up with a person from Sydney, a podiatrist in Sydney, who doesn't actually do normal podiatry. He actually does the mobilisation, which we're talking about. It's a bit like chiropractic for the foot. So that's with Dan next week. I'll let you know when that's going to be up. Have a great weekend. Bye.
See ya.